things, right? Hello, friends. It is very nice to see you all together, and thanks to the technology that we are able to get across everybody together from the comforts of our homes. And somebody is in Jammu, somebody is in Chhattisgarh. So nice to see everybody together. Okay, now about the platform, you all can see this quiz, the Kahoot pin. You can either scan the barcode here, or you can put in the pin, and as soon as you are there on Kahoot, the numbers will start flashing here. We want you all to join in by your real names, not your phone numbers, not your any nicknames. Okay, Rashika is here. Once all of you are here, we'll kick start. And the important thing for all of you to know is that in this platform, the speed as well as accuracy matters. So you would be given questions, and each question, each stem will have 4 branches. You have to say A, B, C, D, and the person who tells the answer fastest and most accurately gets more marks. So we are going to have 30 questions, and all the 30 questions are from different aspects of reproductive medicine. And as soon as we have all the names here, we shall start. Anybody want to ask anything?
How many people are supposed to join, Dr. Manisha?
Sir, we're supposed to
Ma'am, I am not able to join. Please give me some time.
I am also not able to join, ma'am.
Kahoot we have downloaded. We are sharing the link. 903376. ये Kahoot खोलिए ना. Kahoot पे जाते हैं.
Ma'am, how many people are supposed to join?
Kahoot page. Ma'am, we have to go at.
Shivam, please tell them the procedure.
Sorry, I am not able to join. I am not able to join.
Dr. Manjusha, how many people are supposed to join?
Sir, we were supposed to have 16, but I will be having 14.
Okay.
Because 2 UP chapter people, UP East are missing.
Still, we have only 8 people.
Yeah. So, Ashish,
Ma'am, kindly guide how to join.
Shivam, can you please give them the details?
Yeah, ma'am. So you can just scan the QR code, or you can just go to the www.kahoot.it and enter the Kahoot pin there. Just visit this website and enter the Kahoot pin 9033761.
It would be better if you join from 2 devices. That would be easier.
Nine people.
I am not getting where to enter the pin.
You are trying to join from the desktop?
Yeah, from the laptop.
Yeah, so have you gone to the www.kahoot.it?
Yes.
So the page will come, no, 9033761. You can just enter there. The game pin.
Show you my Kahoot screen.
Okay.
So you'll have a screen like this on Kahoot.
Yeah, you are in, Dr. Karan.
Once you touch the join option, you will find a place where to put the pin.
You are in, Dr. Karuna. You're there.
Ma'am, Dr. Mohita, I'm still not able to join. Please wait for a few seconds. Actually, I'm not getting where to enter the pin.
बेटा मैं तेरे को एक मिनट बता दूं.
There is
मोहिता
a
यू आर इन बेटा. मोहिता तुम आ गए हो बच्चे. नहीं अभी नहीं. सॉरी.
नहीं आए हैं मैम, नहीं आए हैं. मोहिता पांडे.
वेट एक मिनट बताओ.
Ma'am, by which device you are trying to join?
I'm trying to join by a laptop desk.
Okay, so you just enter through a website of www.kahoot.it, IT.in.
ये join at www.kahoot.it.
हाँ, just enter that.
Yes, I have entered, but it is still not showing in the
What it is showing?
this already joined people screen.
Ma'am, do you have your mobile with you?
Yes, I have my mobile with me.
Yeah, so hope you can see the QR code. Just scan the QR code.
Yeah, one, 8, 1. Yeah. Please wait. Okay. अब इसमें आंसर कैसे करेंगे? Yes मैम अब इसमें आंसर किस पे करना है?
मैम अभी स्टार्ट नहीं हुआ है कुछ. जैसे स्टार्ट हो जाएगा you can able to answer, right?
Who is this person? 991030. Please put in your name.
We have 13 participants right now. So one more to join.
Yes, Shiva.
So that's me, Dr. Shweta.
Hi Shweta, how are you?
Hi.
So nice.
So I am like, you sent me a message. I said I'm traveling, but I'm joining
So
your
sweet.
Kahoot.
Good evening, ma'am.
So nice. to have
Hi.
you. So nice. You put in a lot of energy into any event.
Thank you.
That's being you. Okay, so some of our people are still struggling to enter into Kahoot. Most are in. We are just waiting for one or two more to overcome the technical, I would not say glitches, but then we all learning. Smriti, तुम आ पाई हो कि नहीं आई हो अभी? Smriti? No, Smriti is still struggling.
Good evening, Dr. Shweta.
Hi. Hello. Good evening, sir. How are you?
Doing good. आप बताइए.
बस अब तो आप set हो एकदम for the final quiz.
देखते हैं कैसे चल रहा है.
Who is this DIV? DIV कौन है बताओ? मेरे पास अभी खाली इशप्रीत और स्मृति दो लोग बचे हुए हैं.
A request to everybody who is not a winner in the chapter quizzes, please do not join the quiz. That will create more confusion.
सर मैंने लिंक ही नहीं दिया किसी को.
नहीं फिर DIV कौन है मैम?
हाँ DIV किसी बच्चे ने अपना नाम .com में लिखा हुआ है. स्मृति और इशप्रीत, please beta spell out your difficulties so that we may be able to help you. आएगी बता दो कौन है. Ishpreet, are you with us? I saw call me now. I can't find.
We're short of 2 people.
No, call me was here a while ago. Now I can't see this person. Okay, call me is here. Ishpreet, please spell out your difficulties here. Yeah, that's what I'm thinking, call me. Are you with us? If you are there. Shivam, is there a technical glitch? Why can't we see call me's name on the screen?
Here it is.
Yeah, right.
So we have 13 participants, madam, right now.
Right. Ishpreet is not able to join us. Ishpreet, beta, are you here? Ishpreet?
Please join.
स्क्रीन में से जो लोग नहीं होते हैं उनका नाम कैसे गायब हो जाता है? We have 13 people. Ishpreet is somehow not able to join.
Find out what is the trouble, then we can sort that out.
Pardon me?
I say tell that person to.
Yeah. Ishpreet, okay, I'll call up. I'll just put myself on mute. Thank you guys for being patient with us. We have to,
Anybody who is having a trouble, please put in the chat box. We sort that out. Even there is a trouble, still we just have 12 people.
Ishpreet is not answering my phone.
12 people are there.
13 right now. Ishpreet ma'am को मैंने भी asked to unmute करा. She didn't reply. So should we start, sir? It's 7:16.
Should we start with 13 only?
Yeah.
Only
one is pending.
I don't want to be unkind to somebody who is struggling with the technical aspects. So I think if somebody...
What I am interested is let her join in the sense, let her come out with the trouble, what is problem she's having.
Yes.
Yeah.
You're not
Actually, I
getting-
tried calling her up, but she's not answering my phone. Maybe she's too perturbed about not being able to get in.
She will wait for another 5 minutes, doesn't matter. Let everybody come.
Ishpreet, please unmute yourself.
She was there in the beginning.
Yeah, she was there. She is still there on the Zoom platform. I can see her name in the Zoom participants, but she's muted. She's not answering my phone.
Is there some response from her?
No, no, sir. She's not answering my phone.
I
So
think we
which
should start. I think we should
Okay.
start now.
Okay,
Yeah.
right, Shweta. So,
No, Manisha, another one has left. Now they're 12 only. Just wait for somebody's missed it. Okay,
we are
now we
13
can
again.
Shivam start.
I think yes. Shivam, would you be happy to? Yes. So welcome everybody. So this is the central zonal quiz, and here we begin. 3, 2, 1. That's it. Yeah. Okay. So which of the following is not an option for fertility preservation in childhood cancers? Oocyte cryopreservation, ovarian transposition, ovarian tissue cryopreservation, and GnRH analogs. We have 8 answers. Please be quick. 8 seconds to go. 6, 5, 4, 3, 2, and that's it. Wow. So Priyanka is the winner, and obviously the not in the option is okay. Which of the following does not require fertility preservation? SLE, breast cancers, bone marrow transplantations, and thyroid cancers. We have 4 answers. Be quick. Which condition does not require fertility preservation? Oops. Okay. The answer is thyroid cancer. All the other 3 require use of cytotoxic drugs. So Palak Bansal has moved up the stage. Good. Great going, Palak. Next question, please. So which is not true about oocyte freezing in cancer patients undergoing chemotherapy? Live birth rate is 35%. It is associated with donor hardening, results in permanent loss of spindle integrity, or there is a higher incidence of congenital abnormalities, which is not true. Please be quick. We only have 6 answers. Time's up almost. Okay. So the correct answer is that it does not cause a higher incidence of congenital abnormalities. Okay. So Palak stays at the top of the tally. Great. Next. Okay. Denudation of oocytes in IVF is done using what? PVP, Hylase, both, or none? Denudation of oocytes. What do we use? Time's running. The answer is Hylase. Please hold here for a while. See, hyaluronidase, it causes the breaking of the bond between the oocyte and the tumulus. So, Hylase is used. The PVP, the polyvinyl pyrrolate, is the agent which is used for sperm immobilization prior to ICSI. So, the answer is Hylase only. Can we have the next question, please? Okay. So, during IVF, the number of motile sperms used for insemination. Very theoretical question. Easy one. 5 to 10,000, 50 to 100,000, 50 to 100 million, or none of the above. I think we have all the answers. Okay. So, almost all of you have got it right. Can we have the tally after this many number of questions? Can we have the scoreboard? Okay, so we have a topsy-turvy. Ashish goes up, followed by Priyanka, Karuna, and Nitya and I also have moved up the scoreboard. Others, please buck up. Please. Rashika now has had the highest score. Okay. Triple gas incubators have the following concentration. Theoretical question. Easy one. We only have 9 answers. Buck up, girls and boys. 5 seconds to go. So most of you have it right. Great going. Well done. So Ashish is still leading. Wow. With quite a good margin. Great. Others, please pull up your socks. You got to come up. Okay. So ICSI is done in What medium? HEPAS, buffer, bicarbonate, either or none? Oh my God, so you're all confused. Okay, the HEPAS buffer is good because it maintains pH during cellular respiration. So it is better than the bicarbonate medium. So that is the agent of the media of choice. There is no confusion. So Ashish remains up. Rashika has moved up and so has Shilpi. Okay, good going. So remember that you have to be correct and fast. Okay. Polar bodies present in which oocyte? Metaphase 1, metaphase 2, prophase 1 and prophase 2. Which one? Basic embryology. Great. So all of you know that. Metaphase 2 oocyte. Very basic question. Next slide, please. Ashish continues to lead. So that's question 9. Which of the following is not included in Bologna criteria? Advanced maternal age, previous poor response, high BMI, and abnormal ovarian reserve testing. Two more answers I want. 2 seconds. Great. So almost all of you have got it right. Well done. I would request you girls to be fast. Okay. So dual stimulation protocol in poor responders implies using 2 ovulogens, using 2 types of gonadotropins, using a double ovulation trigger, or stimulation in 2 phases, follicular and luteal. Easy question. Great. 1%, 2 people got it wrong. Oh, I'm amazed. Anyway, next slide, please. Next question, please. This is the 11th question. So all are pre-HCG follicular parameters except optimal size, leading follicle 18 to 22 millimeters, vascularity covering 3/4 of the follicular circumference, presence of tumulus, and perifollicular PSP of less than 10. All are parameters except. Great. So the correct answer would have been perifollicular PSP of more than 10. So here it is less than 10, so it is wrong. I know why 2 of you have written this. This is presence of cumulus vaporus is not a parameter. It is a parameter, sorry. Yeah. Ashish leads. Kalina has moved up pretty much. She's come to number 3. Rashika, she's had the highest answer streak of 9. Great. Well done, Rashika. You're answering correctly, but you have to be fast. Okay. So all these are risk factors for OHSS except young age, large body weight, PCOS, a higher dose of gonadotropins. Risk factors for OHSS except. Yes. So large body weight is not a risk factor. In fact, low BMI is a risk factor. Others being young age, PCOS, high dose of gonadotropins, high dose of HCG, previous history of OHSS, these are the risk factors. Ashish is still leading. Rashika, highest answer streak. Rashika, you please answer fast so that you move up to the first place. You're still on the 4th. Question 13. Which hormone will you test in infertile women on antidepressants? TSH, prolactin, both or none? This way we have got the answers very fast. All the 12 answers have come in. Well done. Okay, so the correct answer is both. 9 of you have got it right. Okay, now Priyanka Khande also has a high streak. 9 correct answers in a row. Well done, Priyanka. Now you're at the top of the tally. Great. Question 14. According to WHO criteria 2021, normal semen analysis includes volume of 1.4 count of more than 39, progressive motility of more than 30, and normal sperm morphology more than 8%. Which is incorrect. You already have all the answers. Great. So 10 of you got it right. Well done. Priyanka stays on the top. Well done, Priyanka. I'm so proud of you. So, basic question. All of these are diploid except primary spermatocytes, Sertoli cells, spermatogonia, and secondary spermatocytes. Again, very basic question. We only have 5 answers so far. Please be fast. Time is running out. 3 seconds, 2 seconds. And it's up. Oops. Only 5 have got it right. Secondary spermatocytes have haploids. The others have diploids. So Priyanka, you remain at the top, followed by Ashish. Okay. So if semen analysis shows volume of 0.8, count of 0 and absent fructose, what does it mean? What do you do next? FNA, ultrasound, hormones, stereotype. Absent. Okay, let me explain this one bit, okay? Don't move further, Shivam. So this report where the sperm count is 0 and fructose is absent. So fructose is coming from the seminal vesicles. So if the count is 0, fructose is absent, that means the obstruction is beyond the seminal vesicles. So that means it's obstructive dysfunction. So what do we do next if we suspect obstruction? We go in for an ultrasound. We don't need a testicular FNA. We don't need hormones. We don't need karyotyping. We need to look at where the block is. Okay. So we need to do an ultrasound. So that's the correct answer. Next slide, please. Next question, please. Okay. Now we have Priyanka and okay. So all of the following are associated with erectile dysfunction except beta blockers, thiazide diuretics, glucosamide, and spironolactone. No answers so far. Make a guess if you don't know it. You don't have negative marking. Okay. So this feels like ABC. Okay, spironolactone is the right answer. And Priyanka continues to be on the top. Shilpi has moved up a bit. Rashika is in the 4th place. Ashish on the 3rd. Others, please be fast. We are more than halfway up. So causes of non-obstructive azoospermia are hypothyroidism, absence of mass, Calvin syndrome, and mumps. Non-obstructive azoospermia. Very easy question. Just read. Non-obstructive azoospermia. Why so many of you got it wrong? Absence of mass difference is obstructive azoospermia. So simple. If the vas difference is not there, it is an obstruction. So non-obstructive, the vas difference is the answer. Okay. Ashish is now in the 2nd place. Great. Shilpi is, yeah. So which of the following is true regarding registration of an ART clinic in bank? Which is true. Application is made by ART in form 15. Registration fees for a clinic is 5 lakhs. Registration fee for a bank is 1 lakh. And the fee is not refundable if application is rejected. Which of the following is true? Okay. So the correct thing is if your application is rejected, the fees is not refunded. Now, Priyanka is at the top. Great. Great going, Priyanka. Can I have the next question, please? In an ART law, a gynecologist means a PG and OBGYN with any of these. Except, you have to find out which one is wrong. More than 2 years experience, 3 years training, more than 50 oocyte retrievals, and DMN fellowship, which is not true. Great. So we actually need an application experience of more than 3 years to be able to practice this as per the law. Great. Now Kaluna is in the second place. Priyanka stays in the top. Okay. The ovum donor, as per the ART law, should fit the following criteria except, she should be more than 23 years. She should have never donated in the past. She should not be more than 35 and she must be married, which is incorrect as per the ART law. Great. So 9 of you have got it correct. Please, you must know the criteria. It's very important. So Purva is now back with an answer streak of 3. Great. Please try and answering fast. Okay, question 22. According to ART Act, Level 2 clinic can do all of these except perform screening and registration of semen donors, surgical retrieval of male or female bleeds, handling the oocytes outside the body, and transfer of embryo into the reproductive system of a woman, which is incorrect for the ART clinic. Great. So a clinic cannot perform screening and registration of the donors because that is the job of a bank, ART bank, not a clinic. So Priyanka stays on the top. Well done, Priyanka. Question 23. Under the PCPNDT Act, which form must be filled and submitted online by all those doing scans, ultrasound scans? D, E, F or G? Very basic question. You have to put in your practice every day if it practice. Great, form F. So that means all the girls and boys are following the laws. I'm so proud of our young generation. Well done. Well done. Next question. PGT, pre-implantation genetic testing, is not indicated in which condition? PGTM. Previous baby with DMD, father having tuberous sclerosis, thalassemia carrier both partners, and previous baby with open NPD. When will you not do a PGTM? Great. So why don't we do it in open entity previous baby? Because this is a condition which has multifactorial inheritance. So we'll not be gaining anything by doing a PGTM. So Priyanka stays on the top and Payal has moved up. Good. Last 6 questions. Method of choice for creating opening in the zona to obtain embryo biopsy for PGT is what? Chemical methods, laser, mechanical methods, none of them are. How would you create an opening in the zona to obtain a biopsy? Great. So most of you have got it right. Laser is the most accurate method which yields best results. So we use it do it by laser. Okay. So last 5 questions. Embryonic cells used for PGT are best obtained from blastocyst biopsy, polar body, cleavage stage, or any of the above can be done. You already have all the answers. Great. So you all know that it is blastocyst biopsy. Why? Because we'll be thus selecting the most competent embryos and the implantation potential will not be affected by this biopsy. Okay, so Priyanka stays on the top, followed by Kaluna, Ashish, and Rashika. Great work. Purva, you are answering very beautifully now. Last 4 questions. Regarding endometriosis in women wanting to conceive. GnRH is the treatment of choice. IVF is the only reasonable treatment. Endometriomas of under 1 centimeter are best left alone if unilateral, and none of the above is there. Endometriotic women wanting to conceive. Great. So very small endometrioma on one side of the ovary, we will forget endometriosis and treat infertility. Shilpi is back. Welcome Shilpi with a good answer streak of 3. Great. Rashika has moved up. Okay. Easy question. Regarding genital TB, all are true except may present as pelvic pain, amenorrhea is an early feature, intrauterine synechia may occur, and tubal pregnancy is a known symptom. All are true except very clinical. Right. So amenorrhea is not an early feature. It happens later. Okay. So we just have 2 more questions. In an HIV positive man, risk of HIV transmission to female partner through unprotected intercourse is negligible when man is compliant with HRT, his plasma viral load is less than 50, unprotected intercourse is limited to the time of ovulation, and all of the above. When will the risk of transmission be negligible? All of the above, yes, they're all correct. The last question, the final question. Payal has come to the 4th place. Wow, and so has Shilpi. Great going. Regarding neural tube defects, which is correct? It occurs due to failed closure of neural tube between 21 to 28 days after conception. It does not occur by the time of first ANC visit. Folic acid antagonist prevent its occurrence, and Down syndrome is a type of neural tube defect, which is correct. Great. So here we are. Can we have the scores finally? We are at the end of the quiz. We've done all 30 questions. And believe me, all of you have done beautifully, beautifully. Congratulations. Dr. Arun sir and Dr. Shweta, will you please be happy to address the students and announce the results?
Congratulations, heartiest. So, I remember I attended your first quiz and now I'm attending this one. It was really nice. I could see all that up and down and beautifully curated questions.
Thank you so much, Shweta. You keep us all going with
Dr. Arun, sir, your say.
Yeah, thank you, Dr. Mansha. Thank you, Dr. Shweta. In fact, this is for all the participants. This is an excellent initiative by President Dr. Pankaj and Dr. Shweta. And we have been trying to, moderate and coordinate all these quizzes by chapters and then zonals. So congratulations to all the winners. And what we would like to have is 5 people from here. 4 will participate in the semi-finals. But in case somebody drops out or somebody, then the next person eligible is, eligible to participate in the semi-finals. So can we have all these people? They can introduce themselves. Shivam, let them, yeah. First is Dr. Priyanka. Dr. Priyanka, please unmute yourself and introduce yourself.
Thank you so much. I'm Dr. Priyanka. Presently, I'm working in Ashirwad Hospital, Raipur, and I have done my fellowship in reproductive medicine.
Please put on your cameras. Please see your face.
Hello, good evening, sir.
Yeah, you are from which place?
Sir, Raipur, Chhattisgarh, Raipur.
Okay. What are you doing?
Sir, I'm a consultant and IVF specialist here.
Pardon?
And also doing private practice also.
You're not audible properly.
I'm working at Ashirwad Hospital, IVF and IVF Center, Raipur, Chhattisgarh.
Okay. Can we have your telephone number?
Sure, sir. 88825.
Priyanka?
888256629.
888, slowly. 88825.
6629.
Dr. Manjusha, do you have number of these people?
Yes, sir. I have all these numbers.
Okay, please note down all these numbers. Dr. Priyanka, Dr. Karuna, Dr. Rashika, and Shivam, who is 4th one?
Sir, मैं बताती हूँ, मैंने फोटो खींची।
4th and 5th also.
सर मैं एक नंबर बस फोटो है।
Dr. Karuna.
अच्छा नहीं सर, खाली 3 के ही आए थे। चौथे 5वें की फोटो नहीं आई सर।
Dr. 4th कौन है? शिवम?
मेरे ख्याल से पायल।
Shivam.
Sir,
Who is 4th and 5th?
wait a second, sir. I'm sharing.
4th, 5th, 6th also. Give me 6 names.
6th. Wait a second.
Tab tak we can, by the time Shivam is fetching out, can we have Karuna, please? Karuna, please unmute yourself and start your video so that we can all see you. And please introduce yourself.
Good evening, everyone.
Congratulations, first of all.
Thank you, ma'am. Thank you, ma'am. Thank you, sir. I am Dr. Karuna. I am practicing as IVF consultant at Wilson Medicity Hospital, Lucknow.
You are from Lucknow.
And
Okay.
I have done my UG PG from KGMC Lucknow and my fellowship in IVF from IF. From
Payal is 4th, and Ashish is 5th, and Dr. Shilpi is 6th. That's great. Okay, thank you, Dr. Karuna. So you are from Lucknow. Great. So see you in Ahmedabad. The third one is Dr. Rashika. Please put on your video, Rashika, and unmute yourself.
Rashika is from UP West.
Unmute yourself, Rashika. Rashika, unmute yourself. Yeah, please.
Hello, good evening, everyone. I'm from SRMS IMS Bareilly. I'm a third year resident.
Wow. Nice to have PG students do so well. I'm so proud of you.
Thank
Well
you, ma'am.
done.
Thank
अच्छे से
Thank
पढ़ना, बेसिक्स पढ़ के आना क्विज के लिए वहाँ पे।
हाँ जी मैम
हम लोग को किताब लेके आना है वहाँ से, समझ लो हमारी जोन को एक किताब मिलना चाहिए।
हाँ जी
ठीक है बेटा।
जी ओके थैंक यू सो मच मैम
Payal, Dr. Payal.
Sir, am I audible?
Of course.
Yes.
Congratulations, first of all.
Thank you, ma'am. I am from Bhopal. I'm working as an IVF consultant at Nova IVF Bhopal.
Great. Dr. Manjusha, note down the telephone numbers. It will be easier to contact them.
हाँ सर मेरे पास है सर मैंने ग्रुप बनाया हुआ है सब बच्चों का
नहीं आप सिर्फ हमें ये 6 वाले चाहिए. So 2 4 and then 2 as the waiting period.
ठीक है सर मैं इनके नंबर्स नोट करके मैं आपको भी भेजती हूँ
And
सर एक
fifth,
बार सब बच्चों की शक्ल देख लें we'll be happy to see them.
yeah, sure. Ashish?
We have met Payal. Now I want to meet Ashish also, and I want to meet Shilpi also.
Ashish.
Ashish, please.
He is not in the meeting, ma'am. Ashish.
चला गया?
Yeah.
Okay.
Dr.
Shilpi?
Shilpi.
Dr. Shilpi is here. Yeah.
Good evening, sir. Good evening, ma'am.
Good evening.
I am Dr. Shilpi Shrika, JR3 from Shri Ram Murthy, Bareilly.
Wow.
This
You
place,
girls have a
Bareilly.
very good.
This place?
Sir, SRMS, Swami Ram Murthy Memorial Hospital. It is in Mumbai, in Bareilly.
SRMS
So
Bareilly,
happy
sir.
that third year PG students are doing so well, and they are going to come up at the national level. I'm so proud of their training, sir. Isn't it, sir? Sir?
Yeah, great.
Sir, इतने young बच्चे इतना अच्छा कर रहे हैं तो बहुत ही अच्छी बात है.
Dr. Priya is there. I can see her.
Yes, sir. Good evening, sir.
Good evening, please.
Hi, Priya. How are you?
Very fine, Dr. Manjusha. Congratulations. Very well conducted and really good questions.
Thank you so much. Coming from you, it's a huge compliment. You made my day.
Oh, not at all. And I'm so proud of all the winners. Really, we are looking forward to seeing all of you winning in the final rounds.
Oh yes, मैं ये कहती हूँ किताब तो हमें ही लेके आना है, अब हमारी जोन को मिलना चाहिए किताब को.
We would like every chapter secretary to be there at the Fateh region.
Definitely, we'll be there.
Dr. Ruchika, Dr. Anuradha, please.
It's always a pleasure to have the chapter secretaries because we learn so much from each other, isn't it, sir?
Dr. Ruchika, are you there?
Sir, I don't see. Ruchika is here. Ruchika and Anuradha is also here, yes.
Hello.
Yeah,
Hi,
yes.
Ruchika.
Good evening, sir.
Yes.
Good evening, ma'am. Actually, it was muted, so I couldn't speak. Very nice quiz, ma'am. It was very nicely conducted, and we are proud.
Video, we can see you.
Good evening, sir. I'm Dr. Anuradha. It was really very good questions, and they have appeared very nicely, very promptly. Very nice, sir, ma'am. Good evening, ma'am.
Thank you so much.
Thank you, Dr. Anuradha. Thank you, Dr. Ruchika. Yeah, please. We can see you now.
Again, we will see at Ahmedabad, sir.
Sure. We are. Everybody's there.
So we will
Sure,
meet
sir.
at Ahmedabad.
Let's see who will be the winner.
Yeah, it's going to be tough this week.
So best of
Yes,
luck to
yes.
all.
Sir,
So best
sir.
of luck to all the selected candidates.
And also to the chapters, ma'am.
Yes, of course.
Yes.
Chapter secretaries really need to be very, very proactive in training the girls and boys who have won. As Dr. Alam told me that these 4 people will be moving to the nationals semi-finals, and from among these 4, there will be a draw of lots by which 2 teams would be made. So I think, sir, we can tell them the teams now, or we'll tell them at the.
No, Dr. Manjusha, in fact, we are deciding because sometimes, like you don't have 4 people from one zone. Either it can be a random, draft lots, or it can be zone wise also. Like you 4 people, you make your own 2 teams, and then you can be, direct participant in semi-finals. Because there are some participants who are directly from the monthly quizzes also.
Right.
Even they have to be in the draft lots, no?
So about how they are paired up, that you shall be designer.
What I'm interested in is we will do a draft lots there at before the semi-finals there, so it will be transparent. Nobody, tomorrow questions things.
That's good.
So that is 5 minutes or 10 minutes job. We'll put a draw before the semi-finals and then make the teams there.
That's fine.
Sir, 6 people will go or 4 people will go from
So
this?
only 4, madam. But only why we are taking 6 is suppose somebody drops, so we give a chance to the next one.
Okay. Okay.
That is how it is. That is what we did in the chapters also. Like somebody got married. She qualified for the finals, semi-finals, but then she's not coming. So we are missing one person. So then we take the next 5th one. It's something like this.
Okay.
So that person gets selected. Ashish, you are the 5th one, and Shilpi is the 6th one. Let's see if they get their chance.
I think, sir, now that the proceedings are done, can we declare it closed with your permission?
Sure. You can close the chat.
I must extend a very, very warm thank you to Shweta and to and the chapter secretaries for sending us such brilliant kids to participate, and also sparing your own very valuable time to be with us. It's really been a pleasure for me to be conducting this quiz, and I hope you all enjoyed it as much as I enjoyed it up. And hoping to see you all soon at Division. Thank you so much. Thank you so much.
Thank you so much.
Good night, ma'am.
Good night, sir.
Good night.